Dan Williams, Survive Outdoors. If you're new to the channel, we do wilderness medicine videos, how to keep you safe in the outdoors. If you get injured, how to get back safely. Do some gear reviews here and there. So what we're going to talk about today is the pulse oximeter. Do you really need this in your first aid kit? I mean, it basically went crazy with COVID. And I have actually told patients, go out and buy one, and I'm going to give you the parameters. And if it drops to this level, you need to go to the emergency room. And that worked out quite well. However, it can cause anxiety if you don't do it correctly and you don't understand it. Then you're going to freak out and you're going to end up paying an enormous emergency room bill, and you don't need to do that. In the outdoors, what is the benefit of this? So what does this do? The pulse oximeter measures the amount of oxygen that you're perfusing, the amount of oxygen that your little hemoglobin, the little lifeboats in your red blood cells picks up oxygen. And if you're respiratory compromised, obviously this is going to show. It's also going to show your pulse rate. This one actually shows your perfusion index, and we're not going to get into that. That has to do with stroke volume, and it's above and beyond what anyone really needs to know. The issue is that in the outdoors and hiking, high altitude sickness, for example, you're at 5,000 feet, you're a newbie, and you're short of breath. Well, you've listened to our videos and you know you need to probably, if you have a headache and you're somewhat short of breath, you need to drop down a little bit in the altitude. So, or what if your lips turn blue? So there are signs that you're short of breath, kind of a no-brainer. So the issue is that for me, I do not see this being any benefit really when you're up there. It's not like you have an O2 tank with you. It's not like you're going to have meds that you're going to infuse. So the benefit of this in the outdoors, hiking up in the mountains, I just don't see it. Now, there is something called silent hypoxia. Hypoxia is when you have low oxygen. Silent hypoxia is when you're sitting there and you're really not that short of breath. You feel pretty good, but when you get up and walk, all of a sudden, this thing goes from a 98% down to about 94%. And that also can happen if you have a small pulmonary embolism. You're not having any chest pain. That is called silent hypoxia. Of course, that can happen. But if you're going to get up and you're hiking and you're walking in the mountains and you're short of breath and you're concerned, go back down, go back home. That's important. So the benefit of this in the outdoors, in your backpack, not seeing it being that beneficial. So how do you use this? I have another one here by Contact. Both of these work really well. This doesn't have the perfusion index I was talking about on it, which is stroke volume over vascular integrity, and it doesn't basically have that. This one does. This is the one I carry every day. So how do you use it? What you do is you basically just press a button, turn it on, and stick your finger in there, and that's it. But if your hands are really cold, you're going to have to warm them puppies up. Stick them under your armpits, stick them in your crotch, warm your fingers up, stick them in your partner's crotch, and then you're going to get in a fight, and then you're going to wrestle on the ground, and your oxygen is going to be way up, and you're going to be all good. All right, all kidding aside, fingernail polish will definitely decrease this, and you will not get an accurate reading. Long fingernails, that's not going to work. So you got to be understanding that it's not going to be 100% perfect. You can hear it beeping. This one gives a plethysmograph, which shows the heart rate and the beat. And I don't think you're going to see that. I don't know if you can see that or not on there. Probably not in the digital with the camera. So that's how it's used. There is a range. So the American Lung Association, anything from 94, 95 to 97 is good. I argue with that. There's nothing 100% in medicine. If I got a 12-year-old athlete coming in and they're at 95 or 94, that's a little bit concerning. So you have to look at the whole picture. And this does not give you a diagnosis. And you also don't know a lot of times what the baseline is. You're up hiking and camping with your buddy. You don't know his medical history. Maybe he has the beginning of COPD. Maybe his baseline is 94, 93. We don't know. And he's been like that for 5 years. So you don't know the baseline either. You can't just take one little tool and draw a sweeping diagnosis. Short story. I had a friend of mine that I was basically teaching him. He was a grad student in psych. He's doing psych testing. He's having this individual do these drawings. It's called a Bender Gestalt. And the patient is drawing them. He comes back with this whole plethora of different tests. So what do you got? He goes, well, person's really anxious and nervous. I said, well, how do you know? Well, when he's drawing these, he's doing this with the pencil on the paper. Well, did you know that he also had a degree in art? So artists a lot of times will sketch like that. You can't take one reading and draw a conclusion. So that's important when you're in the outdoors with your buddies and something, goes awry. You want to know that. That's important information to know. So you're up camping. You're in Rocky Mountain National Park, just north and west of Estes Park. You've been hiking for 2 hours. And your buddy, who's 45 years old, is sitting there and he says he's fine. He doesn't really look short of breath. He's tapping his feet. He may be rocking back and forth, but he leans onto his knees like this. And you'll see a lot of athletes do that, right? They grab their shorts on the basketball court or they're leaning over, holding on. That helps them breathe easier because they're using their accessory muscles in their chest. When I walk in a room and I see a patient and they're leaning like this, they're trying basically many times to use those muscles to help breathe. So some of the things you want to watch out for when you're up there in the mountains: bluish colored lips, obviously. Are they short of breath? How fast is their rate? Are they leaning forward? Do they have to hang on to something when they're talking to you? These are some concerning things I want you to think about. I hope that helps. I don't carry one of these in my first aid kit. I think it's overkill. It's the Johnny Rescue thing. So be safe. Keep your eyes on the horizon, your face to the wind. Until next time.